Welcome to your February 13th Health Tech Dose. Today, we are digging into a multi-billion-dollar mystery that's just plaguing the pharmaceutical world. You've got companies pouring massive amounts of cash into these super advanced digital platforms, but guess what? The real, critical work is still happening in a hidden world of spreadsheets. So let's pull back the curtain and figure out what is really going on here.
So, this hidden world, it actually has a name, the Spreadsheet Underground. You can just picture it, right? It's this whole unofficial network of Excel files and Google Sheets that teams are forced to build pretty much out of desperation just to get their jobs done. And they're doing it right under the nose of all this expensive, brand new enterprise software. And the scale of this is it's staggering. Get this, a study from Vector Consulting Group found that 89%, that's nearly 9 out of every 10 pharma companies, are right back on spreadsheets for their most important tasks. This is after they've already bought and paid for these huge digital tools. Just wild. And the fallout from this is, well, it's pretty brutal. All that money is just not turning into results. The data shows that a whopping 7 out of 10 of these digital projects, they fail to deliver any real business outcome you can actually measure. We're seeing big companies burn through over $6 million a year on software that's just sitting there, barely being used. And even with all the fancy dashboards, 93% are still having stockouts and 76% are still dealing with delays. Clearly, the tools just aren't fixing the problems.
Which, of course, brings us to the big question, the one we're here to answer. Why? Why in the world are these massive, expensive platforms just collecting dust while the good old, humble spreadsheet is running the whole show?
Well, there's a name for this whole mess. It's called pharma's modernization trap. And it's all about the giant gap between the shiny promise of digital transformation and the messy, complicated reality of actually trying to make it all work.
You know, the promise is so tempting. Vendors come in and they paint this picture of a single, beautiful platform that connects everything end-to-end seamlessly. But the reality, according to data from Tufts, it takes 6 to 7 years to fully implement these systems. 7 years. Think about it. By the time it's up and running, the tech is probably already out of date.
And when you look at this, you start to see why it takes so long. A clinical trial is not some simple straight line. You've got all these different systems for capturing data, managing the trial, electronic records, reporting to regulators, and they all have to talk to each other perfectly. So trying to just rip all that out and replace it with one giant mega platform, it's pretty much a recipe for delay and a whole lot of frustration.
And here's the real problem. This creates a massive bottleneck in the system. We have AI speeding up the front end, right? Finding new drugs faster than ever. But then the whole process of actually testing them in clinical trials just slams into a procedural wall. A wall built out of clumsy software and people trying to patch it all together with manual workarounds.
And this quote from an expert, Chindrachur Datta, really nails the diagnosis. He points out the companies are buying the tool first. They get swept up in a vendor's big promises, instead of starting with a really clear definition of the actual problem they need to solve. It's like they're buying solutions that are just looking for a problem.
Okay, but this whole reliance on workarounds isn't just inefficient or a waste of money. It is actually incredibly dangerous. We really need to talk about the high cost of operating in the shadows.
The official, kind of cool-sounding term for the Spreadsheet Underground is shadow IT, and it's basically any system or solution, in this case spreadsheets, that employees are using to do their jobs without any official approval or IT oversight. It's completely off the grid. And that's where the danger really creeps in. When you're off the grid, you have zero security. You have huge issues with data integrity. Think about it, typos, broken formulas, you name it. There's no integration, so data gets trapped in silos. All of this creates a huge risk of failing regulatory audits. And then there's the most sinister threat of all, data poisoning. So, what is data poisoning? It's a type of cyber attack where someone intentionally feeds bad, malicious data into your system. And since these spreadsheets are often the source for training AI and machine learning models, an attacker can actually corrupt the model itself, leading it to make dangerously wrong predictions.
And here's the part that's truly terrifying. Look at how easy it can be. Research from JMIR Security shows it can take as few as 100 to 500 bad data points to effectively poison an entire machine learning model. That's a tiny, tiny fraction of the data you'd find in a normal clinical trial.
This is exactly why regulators are starting to pay very close attention. As attorney Robert Paradiso points out here, regulators expect things like validation, monitoring, and clear accountability. They need to know the data is secure, that it has integrity,
and the Spreadsheet Underground makes that completely impossible to prove. Okay, so if buying a giant platform is a trap, and just relying on spreadsheets is super risky, where does that leave us? Well, the solution isn't about choosing to buy versus build. It's about putting together a whole new kind of team.
The key idea here is to just stop thinking about replacing everything. The real solution isn't another box of software you buy off a shelf. It's a totally different approach, one that focuses on integration, on connecting the systems and tools that you already have and making them work better together.
And this whole approach is brought to life by a special team called the Product Trio. It's pretty simple. It's made up of 3 key roles. First, you have the strategist, or the product manager. They figure out the why. Why is this tool even needed? Second, you have the user advocate, or the designer. They focus on the who, the actual people who will use it, and they make sure it's not a nightmare to work with. And third, you have the integrator, the engineer. They figure out the how to actually connect it to everything else that's already there.
See, this team's entire mission is different. They aren't just being measured on whether they go live with a new piece of software. Their actual goal is to solve real specific problems on the ground by building bridges between the vendor's software and the day-to-day reality of the clinic. They're the ones who make the expensive tools finally work for the people who really need them.
And that leaves us with the final, and I think the most crucial question to take away from all this. When you look at your own organization's tech strategy, you have to ask, is your team focused on building bridges to make things work better? Or are you just buying more boxes to put on the shelf?